From NBC 40 News, this is Forum 40.
Hello, I'm Robin Stoloff. Welcome to Forum 40. You cannot have missed the constant news coverage about Ebola, and it's created widespread fear of this potentially fatal disease. And we have increasing concerns about the respiratory illness enterovirus D68, which has been responsible for several deaths across the country, most of them children. What do we know about these infectious illnesses and how can we prevent them? Our guest today can help us make sense of it all. We will get the medical perspective on how to prevent and treat these infections from an infectious disease specialist. A public health officer will share important information on how our community prepares for these diseases. And we'll meet a hospital safety officer and school superintendent to discuss healthcare systems and school protocols to protect healthcare workers, patients, and of course our children. Here with us first is Dr. Manish Trivedi, an infectious disease specialist from AtlantiCare. Thank you so much for joining us. As I said, we hear so much about Ebola, but it's really not an epidemic or an outbreak in this country, is it?
That's correct. And we've only had 3 cases in the United States since its discovery in 1976. And since then, we've quarantined all of those patients, so it's not necessarily that scary here anymore.
Right, you just hear so much about it in the news and everyone's afraid of it.
That's correct.
But, you know, just so that we can be aware, how is it contracted and what should we know about it?
So Ebola is contracted through human-to-human contact, and more specifically through their infected body fluids. And so it's not necessarily just bumping into an individual, it's having extensive contact with, let's say, sweat, saliva, sometimes urine, feces. So a lot of healthcare providers are affected by that.
At greater risk, of course, and I know that they're putting many more precautions in place to protect them. What are some of the symptoms of Ebola if you get it?
Yeah, so initially the phases of Ebola's, the symptomology, include fevers, weakness, sometimes a sore throat, a myalgia, and then it typically kind of progresses into bleeding. You'll get oozing, bleeding from your gums, sometimes diarrhea that has hemorrhagic components to it.
What are some of the treatment options? Can we treat this disease?
Typically it's supportive care, initially identifying it early and applying supportive measures including IV fluid, rehydration, food is our only options right now.
And there have been people that have survived it, so
that's
obviously
correct.
That can happen. But we do need to talk about enterovirus D68, much more common. If you could tell us how that works and why we're seeing more of it this year.
Yeah, absolutely. So enterovirus is a little different than what Ebola is. It's airborne, it's droplet precautions, and so you can get it from sneezing, almost like the common cold, the flu itself. We're seeing a lot more of it this year, just I think because of our technology. We're able to identify it quicker and able to kind of attempt to fix that.
And there's many strains of it. It has been around for a while, but this particular strain has been proven to be a little more difficult and in some cases fatal. Who does it affect?
That's correct. It's typically seen in children. Almost the ages of 5 is the common age group for this. It ends up with patients with asthma causing more shortness of breath, more difficulty with breathing, and also sometimes neurological side effects.
I'm a mom, so I hear that, and that scares me. My son has asthma. He's a little older than that. He's 14, but still, you hear something like this and you go, wow, it sort of mimics the common cold. How do you know when to go seek help?
I think the progression of the disease itself. Sometimes when you get the common cold, your asthma gets exacerbated. That's almost side effects of the flu. But when it gets to a degree where you can't control it with your medications is when you should seek professional advice.
Okay, so just keep an eye on it, and if it gets worse, I mean, don't wait. If you suspect anything at all, go ahead and get treated.
That's absolutely correct.
It is has come to New Jersey, but how at risk are we?
I think we're at a moderate risk level right now. It's flu season. I think things to do to prevent being exposed to these include covering your mouth when you cough, when you sneeze, washing your hands. I know it's difficult to have children wash their hands, but that said, it's one of the practices that would help avoid.
Sure, and you know, you mentioned flu, and flu kills thousands and thousands of people in our country every year, and yet for some reason that doesn't seem to get as much press or whatever as Ebola. It's not really the disease of the hour right now, but that really, there's some things that we can do to protect ourselves from flu.
That's absolutely correct. I think the single most important thing to do to protect yourself from the flu is get vaccinated. The flu shot every season can help you stay healthy and help your family stay healthy as well.
Because flu can be serious. I mean, a lot of people sort of, you know, the flu, the common cold. What can happen if you really, you know, don't treat it and don't take care of it?
You're absolutely right. And the flu ends up steamrolling into something a lot bigger than just the common cold. Oftentimes you get exacerbations of chronic conditions that can put you in the hospital, including asthma, CHF, diabetes. You can get bacterial pneumonia that superimposes on the flu as well. So there are a lot of different things to look out for with the flu.
What actually happens with different strains of the flu, and why do we need a different flu shot every year?
So unfortunately, we're always behind, I guess, the epidemic of the flu. It's constantly mutating, it's constantly changing, and so we need to have vaccines that encompass a variety of different strains of the flu, and that's what we try to do every year, is to predict the flu season.
We don't cover them 100%, though. Is that correct?
That's correct.
Yeah, but we do cover the ones that we suspect would be the most common.
That's right, the most common.
And so what does a flu shot actually do? When it enters your body, what is it? It's not a live virus, we should say that.
Well, that's correct. And so what you end up having is you develop antibodies to the flu, and while you're developing those antibodies, you may get flu-like symptoms, but only for a short duration while your body adjusts to developing these antibodies. And that, again, protects you from the most common strains.
And that's when you hear from people, oh, if I get a flu shot, I'm going to get the flu. That's just,
right.
We want to just dispel that myth here and now. That does not happen.
And that's a common misconception, and that isn't the case. You actually, it's your body developing antibodies, and you're having that kind of reaction to it.
But it's a short-lived thing.
That's correct.
And it's not as serious as a flu. I mean,
Not
so
at
if
all.
you think about that for a very short time compared to getting the flu for maybe weeks,
it can be devastating.
Something worse.
You're absolutely right.
Right, so it's important to get that flu shot. So, but every year there's a different one.
That's correct.
So that's why you have to do it. And what time of year and who's at most risk for the flu?
So typically we're in this flu season now, and so it's typically the fall into the winter months. Those that are at risk are anybody above the age of 6 months. But the most common people that kind of can get, I guess, sidetracked by the flu, our age is greater than 65, and so our elderly are those that we want to be prepared for.
Definitely. Elderly, weaker
That's correct.
folks, if their immune system is compromised in any way.
Absolutely.
And of course, our children as well. I know I do it every year, and I do it with my kids. So they see me get it, and I try to set the example that it's an important thing to do. It's a little, you know, tiny, quick second of pain.
That's
You know,
right.
they don't love it. It's okay, because then we talk about what can happen if you don't get it.
You're absolutely right.
You know, so it's very important to take care of that. So I know AtlantiCare is on a mission to get everyone flu vaccinated this year. And I do want to ask, why is it the winter season? Is it because we're in such close quarters? It's not really the weather so much, or is it?
Well, I think it's a combination of both. I think the weather allows for these strains to proliferate, and then because we're all kind of in close quarters, it spreads more quickly, and that's kind of
we're
why
indoors, and yes, we're around each other a lot more. Yes, not outside. Okay, so well, very good information. Thank you so much for joining us, Dr. Manish Trivedi. I think you helped people alleviate some of their fears about getting the flu shot, and also gave us some good information about Ebola enterovirus D68. Thank you so much for joining us.
Thank you.
And up next, we'll meet Patricia Diamond, Atlantic County Public Health Officer, to discuss how our community can prevent and prepare for these types of illnesses. Stay with us.